Hi, Namaste, Dr. KMK Reddy. Today we will discuss a burning topic in the recent days, that is healthy looking people, very physically fit people, young people, celebrities, very important VVIPs. They are leaving us and they are suffering from a serious heart attacks, and it is causing a lot of panic feeling in the public. Let us try to understand, and I am trying to clarify certain panic feelings that are there in the society based on all these things. To tell you the fact, WHO has warned India specifically about stroke in young, heart attacks in young people. Young people in the sense like less than 45 years of age, people also are going to have a serious heart attacks in India. This is going to be very huge in number. By the year 2030, our India is going to have a massive, huge, large number of people who are going to be hit with this type of problems. By telling this, I am trying to share the signs rather than creating a terrors or jitters in the society. I am trying to clarify or give some insights what exactly is the fact, why all these things are happening. Many people will have a doubt once we do exercise, once we maintain our body, or once we build up the muscular body, everything is fine with us. See, definitely having a good physique, having a good body is advantageous. There are some risk factors that are studied and the research has already been done. Based on this data, the WHO, World Health Organization, has already warned India. This is a fact. It's not a new thing. It is not new to the profession. It is not new to the cardiology society. There are a good number of risk factors, unfortunately, like sugars, that is diabetes, high blood pressures, smoking, high cholesterol, high stress levels, high BMI. So this is how the things are. But another important, apart from all these things that are mentioned, and another important risk factor is a family history. Family history of coronary artery disease, family history of premature coronary artery disease in the first degree relatives like parents or in the siblings is a risk factor, definitely. It doesn't mean that it involves 100% of the people. Suppose the first degree relatives are having a premature CAD. A premature CAD means if a first degree relative like a sibling or either of the parents, suppose let us say if the father has died less than 55 years of his age because of the heart attack or a sudden death without knowing the reasons, assumed to be a heart attack. So if a father passed away in the less than 55 years of his age, it is a risk factor for us, definitely. If the mother died the same way in less than 65 years of her age, also a risk factor. If the sibling also is having a coronary artery disease, passed away, or is having a coronary artery disease, or a heart attack, or some stenting done, or some bypass done. So all these things, if there is an evidence of coronary artery disease or a heart attack, these things become a risk factor for us. This is something called a family history. So family history, most of the times, most of us forget and talk and panic. So therefore, ladies and gentlemen, what I am trying to impart in this video is, let us not panic because of these things. I know there are many VVIPs and celebrities and very popular people pass away, unfortunately, in the last 2-3 years too. At least in the last 2-3 years, we lost a good number of prominent people. Unfortunately, this is really a very sad situation. There is no doubt in that. I can totally understand as a human being and also a doctor. Definitely lost to us, but these things should not create a panic among the society, panic among ourselves, but these things should give a good message or lessons for us to be alert, to be more scientific in assessing our own risk profile for a coronary artery disease, for a heart attack, and get tested with our own familiar cardiologist. This is very important. This step is very important. We need to evaluate what are the risk factors we have, whether there is a family history, or whether there is a diabetes, hypertension, or are we smokers, our cholesterol is very high, or our BMI is very high, are we leading a very seriously stressful life? So understand, analyze ourselves. If there are good number of these type of risk factors, our risk will be multiplied, not added. So be careful about all these things. Don't hesitate to see your cardiologist. Go to your cardiologist. Discuss openly what are all the risk profile or factors or the diseases or the issues that are there for you. Discuss with your cardiologist. If you tell everything to the cardiologist, he will have a scientific analysis of all these risk factors. Based on this, he will guide you what is to be done to protect your own health. This is very important step. It's a very crucial step. It is the time for us to be very, very scientific, very, very careful, very vigilant, rather than panic and probably spread the things among the society to create more panic feelings. Therefore, the entire people or the people who have some vulnerable factors like this become really, really sick, and they will have a lot of inconvenience, I can say a lot of damage that happens not only to the individuals at a large to the society. So therefore, ladies and gentlemen, I am appealing to you all, try to understand what are the risks you have, what are the risk factors you are having. Based on all these things, see your doctor, try to have a scientific analysis of your data, and probably based on the things, your risk profile or the risk score, your consultant will definitely guide you. There are some good number of ways to evaluate the people who are at risk of all these diseases, and how to evaluate, what are the things to be done, how to prevent all these things, we are going to discuss in the next video. Till then, thank you.